Rob Shapiro from Technique Peak. Taking a look at a way to work on a nominate or pelvic bone that is more in an anterior position. Again, we don't think things happen so much in the joint per se, but just the whole pelvis has rotated, let's say, forward on the right, anterior, and we could go over ways to test it. Let's say we did test it, we kind of went through. Our quick test might be go on to the right below ASIS, hand on the back, and just do the glide and see if I push, take up the slack, does he have a posterior rotation on that side? And what I want to feel for in the back, do I feel that between the sacrum and the ilium, do I feel that little bit of a nodding of that posterior rotation of this innominate? If we don't, we could do, one of the techniques we could do is have his foot in this position, okay, come up as high as he can, sit in his foot, and what I'm doing now is I'm just going to lean back, and by doing that, I'm going to pull on the ilium or pull on the pelvis. It's going to help rotate it posteriorly. It's a really nice technique. It kind of feels good, a deloading type technique. I mean, we know we can't get very specific. We SI, L5, L4, we're getting all those joints to move, but it is a really nice way to unload that tissue. And again, if the pelvis is what we call more of a positional deficit, where it's just not in its best resting position, to be optimally functioning, we could do techniques like this. We could hold it for 30 seconds. If the patient is getting relief from it, we could teach them how to self-do it, or could have a spouse or significant other do it, or the self-do it. Justin, I want you to take your knee, keep your foot where it is, and I want you to push your knee past your toe. It's like a unilateral bridge, but what he's doing is pushing his knee over that direction. He's stretching out that tissue, putting stress to that tissue, getting his glutes to work, which helps for that posterior rotation. Try it again, push it that way. You can go pretty high as far as you're comfortable going without lifting up that side, right? So it's a self-mobilization. Okay, so your patient has an anterior rotated pelvis. This might be a way to help them decrease the tissue load. Rob Shapiro from Technique.